Hi everyone, Dr. David Kulla here with Synergy Wellness in New York City. We have another patient here with a hiatal hernia, and his symptoms are difficulty getting a full breath, and of course the poor guy had to climb up five flights of stairs to get here in the office today because we almost had a fire today in this building, which is scary. There was some sort of electrical fire out on our building in the sidewalk. So we had to shut down the elevator for the meantime. But you made it up, huffing and puffing. But those are the issues he's having. And he noticed it 2 weeks ago, 2 Wednesdays ago, after you worked out. It wasn't any specific moment, right? Correct. He noticed it after working out. And I've done a video on working out and exercising. There's a couple of things that you want to be really mindful of when exercising, okay? Number one, you don't want to do this when you're pulling the weights off the rack and bend down and pull them off the rack. You want to bend at the knees. I know you can't see my knees right now, they're cut off, but you want to bend at the knees, pull the weight off, and then lift it up with your legs. Our legs are way stronger than any other part of our body. Use them, okay? Use them. Use the strength in your legs to pick up weights at the gym. Do not bend over. Do not bend over and pick up your daughter or your son or your grandkids. Okay, be careful about doing that. And then of course, breathing properly. You want to make sure you're breathing properly through the exercise. Even if you have it backwards and you're breathing out or in versus flexing or bringing the weight up. Honestly, as long as you're breathing in and out, while you're exercising, in the middle of that exercise, do not hold your breath. That can force the stomach up and herniate it. And he has scoliosis. He has a pretty significant curve. It's a 29-degree curve. Correct. So that's considered significant. Anything over 24, they're starting to consider surgery. So he's doing some Schroth exercises and some chiropractic, but right now we're really focusing here on his hiatal hernia and reducing that, mitigating the risks of re-aggravating that, and just getting him to be able to breathe better. And usually it's pretty instant, the breathing. So we're gonna go ahead and do the maneuver on him, and let's see what kind of results he has after one treatment, okay? We don't know what to expect. He's not a paid actor, so I hope for my sake, he has some results after his first visit, but not everybody does after their first visit. Again, breathing issues are typically noticed pretty quickly, okay? No need to be nervous, okay? Just breathe normally, okay? And it's a little bit uncomfortable, but it's really not that bad. It's like getting a deep tissue massage in an area that's sore. This is the best way I can describe it, okay? Okay, I want you to go ahead and do a sit-up for me. Good, and come back down. Okay, so what I was doing there was just sort of checking to see if he has an abdominal hernia. Okay, so an abdominal hernia would be a bulge in the front of your stomach right above your belly button. If you have a bulge there where it sticks out and bulges out when you kind of come up and do a sit-up, in the center above your belly button, you have an abdominal hernia, not a hiatal hernia, and you should be thankful of that. I'm not saying you don't have a hiatal hernia, you could have both, but that bulge is your abdominal hernia, not a hiatal hernia. Hiatal hernia cannot be seen by the naked eye. You cannot see it herniating straight up into your chest cavity or through your diaphragm. Only an abdominal hernia you can see that. Okay, did you know that?
I did not, now I do.
Well, good news is you do not have an abdominal hernia. So anybody know some other things that can limit your ability to breathe or get a full breath in? Anybody? Some of you are probably thinking at home, well, smoking? Yeah, of course, bronchitis, smoking, emphysema. Aside from the obvious, okay, let's do that. Aside from the obvious, one other thing that can cause it is this forward head curve. That forward head posture. That can reduce vital lung capacity by 30% just from having your neck kind of bent forward like that, okay? That's one thing. Scoliosis is the other thing. Scoliosis, especially if it's severe enough, kind of put pressure on the lungs and collapse the lung just a little bit, not where it's completely collapsed, but it can put pressure on the lungs where you're not able to take a full breath in. But typically you're going to see that in people with a more serious scoliosis. And part of his difficulty breathing, part of it, a small part of it, might be because of his scoliosis. But he was not complaining of that 2 weeks ago. And trust me, he had scoliosis more than 2 weeks ago, even more than 2 years ago. He's had scoliosis since he was a child, 11, 12, 13. So my guess is in his situation, it's probably not caused by the scoliosis, but you could probably increase his vital lung capacity by a good 10, 15% once that scoliosis is straightened. So he's got a little bit of bloating here, but it's not too bad. We're going to kind of get through layer by layer here. Now I'm actually going to adjust him. So go ahead, lay on your stomach. So he has a scoliosis here in the thoracolumbar area, which is right where our diaphragm is. Go ahead and bend your knees for me.
Bend my knees.
Yep, both knees. There you go. And take a deep breath in. Good. Blow all the way out. And again, deep breath in and blow out. Good. And again. And blow out. And drop your legs down. Okay. Take a deep breath in again.
Wow.
That right there is your brachial plexus. Turn over on your back and slide down a little bit. Good, and cross your arms here. Tuck your chin down. Take a deep breath in. And blow out. Okay. So what I just adjusted on him was, you notice I did it up high at the very bottom of the neck and the top of the upper back, because those nerves go to what? The lungs. Yes. So nerve supply to the lungs directly comes from your spine, your upper thoracic spine. Okay, so that's why we adjusted that area today, FYI. And you should be getting that area adjusted every time, as long as you have difficulty breathing. Okay. And slide this underneath. Okay. Okay, now you're going to want to come up and sit up. Don't sit up. I want you to roll to your side, to this side. Oh, no. Put your legs back up all the way onto your side first. There you go. Now push off this elbow and this hand and swing your legs at the same time. There we go. Okay. Go ahead, take a deep breath in, face the camera, see how you feel. How's it feel?
I feel a lot more relief. I can take a much deeper breath. It's not 100%.
Okay.
I feel like as we continue our treatments, it'll definitely get better, but I definitely do feel a lot more relief now.
Okay.
I feel like my posture got a lot better, and while you were doing the maneuver, I almost felt like my stomach being pushed back down. So is that normal to feel?
Yeah, yeah, and it could be a little bit uncomfortable as we get further down towards the belly button. So
Right,
we lay off layer by layer as we get down there, which is the belly of your stomach. So there you have it, folks. One treatment, some relief, not 100%. And we're going to continue treating him this week or next week. It's the end of the week, but and we'll follow up with him, and we'll be sure to show you guys as long as he's okay with it, which he seems to be. So, all right. Thanks for tuning in. Appreciate you. If you have any comments, feel free to comment below. Thanks. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.